Hi, I'm Daniel. I'm a sleep physician, and if you have insomnia, this channel is for you. Nice seeing you back here, and if it's your first time on the channel, welcome. Hope you find something of interest here. Today we're going to talk about paradoxical insomnia. This was described to me in sleep fellowship as a very rare cause of insomnia, and that's often what you find if you Google it as well. In reality, I think it's very common, and I'll comment on that a bit more in just a second here. So, what is paradoxical insomnia? Well, paradoxical insomnia is defined as a big discrepancy between how much somebody thinks they sleep and how much they actually sleep. People estimate sleeping much less than they actually do in paradoxical insomnia. The classical kind of full-blown case is rare. I'll definitely agree to that. The typical presentation is somebody coming to the clinic and saying, I don't sleep. And you say, oh, how little do you sleep? And your patient says, not at all. And then you go, well, for how long has this been going on? No. I don't sleep at all. And I haven't slept at all for months. If you hear somebody saying that, they have paradoxical insomnia, because it's just not compatible with life not to sleep at all. So they're definitely underestimating a lot. Now, that is rare. I've probably only seen maybe, a handful, 2-3 patients that have felt like they didn't sleep at all. What is very common though is a more subtle variety where somebody sleeps 7 hours, but they think they sleep 5.5, or they sleep 8 hours. They feel like they slept 6 hours, something like that. And what causes paradoxical insomnia? Well, I think more than any other type of insomnia, paradoxical insomnia is caused by a hyper-aroused state. Most people with insomnia have, to some degree, are hyper-aroused, meaning, kind of a little bit on edge, mind always racing, have a hard time relaxing, and are very aware, like hyper-aware of what's going on in their surroundings. And what happens is that when they're sleeping, they drift from wakefulness to very superficial sleep, back to wakefulness, superficial sleep, wakefulness, and it feels as if they're not sleeping at all, or sleeping much less than they actually are sleeping. Now, how can you tell if you have paradoxical insomnia? Well, I think one really good clue is if you have a really hard time estimating how much you sleep, you probably have paradoxical insomnia. I find almost always when I review a patient questionnaire and it says there, how much do you sleep, and the patient puts a question mark or like they don't know, and you then do a sleep study, it turns out that they underestimate a lot. So not knowing how much you sleep is a clue. Another one is if things kind of don't make sense, meaning you feel like you sleep like 2.5 hours, but then you're not sleepy during the day. That's another clue that you are probably sleeping much more than you think you are sleeping, or what it feels like sleeping. Now, I was just toying around with ideas of how could you test this hypothesis yourself. Well, one would be to set an alarm on your phone and put it at a very kind of low volume, and then if the alarm does not wake you up, then you know that you did fall asleep. Another one could be the classic Edison method of holding like a teaspoon in your hand and holding it over the edge of the bed. Actually, you know what? Not a teaspoon. Something that you won't hear falling is better in this case. So if you find that it's dropped to the floor, for example, then you have fallen asleep. Just some thoughts there. Now, if you feel like, I think I have paradoxical insomnia, what should I be doing? I just kind of did a little quick review, and what I do in clinic seems to be what you should be doing, meaning cognitive behavioral therapy. Just as it is effective for other types of insomnia, it is the most effective way to treat paradoxical insomnia as well. You can Google cognitive behavioral therapy for insomnia. You can search out a sleep coach. You can watch previous videos, particularly, as I always say, bedtime restriction. My first video, the video enabled Insomnia Insight #1. There's a follow-up at Insomnia Insight 14 and 21 as well for that one. And stimulus control, of course, which is Insomnia Insight number 5. If you have any questions, as always, please let me know. You can leave a comment or email me at this email address, and I hope to see you back here very soon. Thank you.